There is currently a vitamin in your medical cabinet that, according to study, raises the risk of hemorrhagic stroke by 22%. 22%. And the scariest part, you presumably took it this morning, thinking you were safeguarding your health. If you're over 60 and take vitamins, you should know this. In fact, if you're watching this video right now, you could be one of the fortunate ones. I'm Bon, and I'm here to provide some simple techniques to protect your golden years. Welcome to Bon Senior Health. If you haven't subscribed yet, we may never see each other again. But if you are, congratulations for caring about your health. Let's plunge in. Barbara, my neighbor, a vivacious 71-year-old grandma, came to the doctor for her regular checkup 3 weeks ago. She was doing everything correctly. Mediterranean diet, daily walks with her neighbor. She proudly displayed her vitamin routine. I take extra vitamin E, she told me, 800 IUs for my heart. Perhaps their blood became frigid because they knew something that Barbara didn't, something that could have caused a brain bleed that same night. And I knew why, since I had been examining the most recent research from the Mayo Clinic and Johns Hopkins. Multiple studies with over 300,000 participants. The findings were so concerning that they are scrambling to change medical standards. However, this might take months, if not years, to reach the general population. They observed that high-dose vitamin E not only does not protect your heart, but it actually raises your chance of hemorrhagic stroke. That's when a blood vessel in your brain bursts, flooding sensitive tissue with blood. This danger is especially high for persons over the age of 60. I realize this sounds impossible. Vitamins are meant to be healthy for us. Correct, this is what we have been told for decades. But here's the alarming fact that's keeping neurologists awake at night. Vitamin E supplements work entirely differently in your body than vitamin E from food. It is concentrated. It inhibits your blood's capacity to clot. And in your aging body, it becomes quite harmful. Allow me to reveal something that will make your jaw drop. As you watch this, millions of seniors are taking vitamin E amounts that science has shown to be hazardous. Doses that appear innocuous. Doses are available in every drugstore in America. They have no concept they are playing Russian roulette with their head. The medical establishment is scurrying. However, they are moving slowly when individuals are having strokes right now because they are unaware of what you are about to learn. Here's what occurs in your brain when you take a high amount of vitamin E. This is critical, so pay close attention. Platelets are small cells found in the bloodstream. Think of them as your body's emergency repair team. When a blood vessel develops a small leak, which is more common as we age, these platelets race to seal it. However, vitamin E makes your platelets slippery, similar to trying to repair a leak with wet soap. They are unable to stick together adequately. Now, for someone with thick blood, a little vitamin E may help. However, most seniors do not have thick blood, which is a terrible fact that is rarely discussed. In reality, beyond 60, your blood naturally thins. Your blood vessels will become more brittle. It is a natural aspect of aging. When you combine high-dose vitamin E with this equation, you get the perfect storm for a hemorrhagic stroke. Imagine this horrible scenario. It's 3 a.m. You are resting peacefully. However, a little blood vessel inside your brain weakens with age and begins to leak. Normally, your platelets would rush in and close it before you even awoke. However, they cannot. Vitamin E has rendered them too slippery. The leak becomes a trickle. The trickle becomes a flood. Brain cells begin to die by the millions, and you won't realize it's occurring until it's too late. This is precisely what occurred to another neighbor of mine, Richard, a 74-year-old retired teacher. His wife discovered him in the morning, disoriented and unable to communicate clearly. He was fine the night before. They had played cards with friends and smiled at their grandchildren's videos. However, while he slept, vitamin E stopped his blood from clotting properly when he needed it the most. The brain scans were terrible. Following a hemorrhage, Richard struggles to find words. He can't remember the names of former students who come to see him, all because of a vitamin he believed would keep him healthy. But here's something even scarier. What dose contributed to Richard's stroke? It wasn't a megadose. It had 800 IUs, which is the quantity sold in most drugstores and is frequently marketed as heart-healthy or senior formula. There were no warnings about stroke risk. There are no age limitations. Simply joyful marketing promising improved health. Dr. Michael Chen, a neurologist at Stanford, recently told me something that bothers me. According to him, we're seeing more and more hemorrhagic strokes in seniors taking high-dose vitamin E, and they all say the same thing, but doctor, it's just a vitamin. Just a vitamin. Those three words have become among the most harmful. The research is overwhelming and undeniable. A detailed review published in the British Medical Journal looked at 9 significant trials. What's the conclusion? Vitamin E administration elevated the risk of hemorrhagic stroke by 22%. Let that sink in. A health supplement is responsible for nearly 1 in every 4 extra strokes. A Harvard study of thousands of physicians discovered the same worrying pattern. The Women's Health Study, which followed over 39,000 women, validated it again. The data is obvious from study to study and country to country. However, vitamin E continues to fly off drugstore shelves, particularly among seniors who believe they are being proactive about their health. And things grow worse, significantly bad, because vitamin E does not function alone in the body. It interacts with more than 200 common drugs, blood thinners, such as warfarin or aspirin, a deadly combo, statins for cholesterol, increased bleeding risk. Even certain antibiotics can cause hazardous interactions because the research is still in its early stages. Your doctor may be unaware of all these relationships. Patricia, who was 70 years old, nearly died from internal bleeding. She was taking vitamin E along with her blood pressure medication and a daily baby aspirin, as her doctor had advised. However, when combined, these transformed her blood into water. It required 4 units of blood to save her life. When she awoke in the ICU, with tears flowing down her cheeks, she said, "How could vitamins do this to me?" The response always destroys her heart. We've been treating vitamins like sweets when they should be treated as potent medications, because that is what high-dose supplements are: medications with the potential to heal or hurt depending on how they are used. Now I need to disclose something really personal. My own sister, a retired nurse who should have known better, began taking high-dose vitamin E when she aged 72. She had read articles on how it could help prevent Alzheimer's. 6 months later, I received the call that all doctors dread. She fell while preparing breakfast, a hemorrhagic stroke. We were lucky. She survived. However, watching her relearn to walk, struggle to recall her children's names, and fight for every word, it altered me. It made me realize how many individuals carry around this unseen time bomb in their medicine cabinet. The rehab was terrible. 3 months at the hospital, 6 months of outpatient treatment, learning how to hold a spoon again, learning how to write her name. My brother-in-law turned 10 in 6 months, witnessing the woman he had loved for 50 years struggle with chores that a child could perform, all because of one vitamin. She assumed the vitamin would preserve her brain. But here's something that may surprise you even more. The supplement sector generates $50 billion in revenue. They invest millions in marketing, telling us that more is better. They fund studies that aim to demonstrate benefits while downplaying hazards. They lobby against rules requiring clear warning labels on their products. They do not want you to know that manufactured vitamin E supplements are not the same as vitamin E found in almonds or spinach. They don't inform you that the danger of having a stroke grows with each year after you become 60. They surely don't indicate that taking 400 IUs or more per day is dangerous for seniors. I recently attended a medical conference where a researcher presented facts so concerning that several doctors in the audience screamed. Hemorrhagic stroke rates among seniors have increased by 15% in areas with heavy supplement use over the last decade. 15%. And vitamin E supplementation was the most powerful predictor. Walnuts are another brain booster. They even resemble small brains, possibly a clue from nature. But seriously, the research on walnuts and cognitive performance is outstanding. A handful per day keeps your brain functioning properly and your blood vessels healthy well into your 80s and 90s. This is why I am speaking to you personally today with urgency and honesty. If you're taking a high amount of vitamin E, especially if it's combined with other supplements or drugs, you should consult your doctor right away. Not next month at your checkup, not when you finish the bottle. Today, right now. Don't allow pride or stubbornness to put your life in danger. I've seen far too many folks who believe they knew better, who reason that they've been taking it for years with no problems. So why worry? However, stroke does not send warning letters. It strikes unexpectedly and devastatingly, often with no warning symptoms. Now, I do not want you to feel helpless or terrified, because there is also some wonderful news here. All of the vitamin E you need can be obtained safely from food. When you consume vitamin E naturally, your body understands exactly what to do with it. There is no risk of overdosing. There is no danger of having a stroke. Just pure protective nutrients as nature intended. Almonds are great. A little handful provides enough vitamin E for the entire day. Not 800 IU, not 400 IU, just the right amount that your body can safely use. Sunflower seeds work well too. Add a tablespoon to your morning porridge and you're set. Avocados are not only delicious, but they also contain the appropriate type of vitamin E and beneficial fats that protect your brain. Spinach, sweet potatoes, and perhaps a splash of olive oil for your salad. These foods not only supply vitamin E, but also other nutrients that help your body use it safely and effectively. But here's what really excites me as someone who has spent decades researching brain health meals that significantly reduce the risk of stroke while posing no hazard. Take blueberries, for example. The research on blueberries and brain health is simply remarkable. They include chemicals capable of repairing brain cell damage and strengthening blood arteries. I tell all of my family members over the age of 60 to consume a cup of blueberries every day. It makes no difference whether it's fresh or frozen. Simply eat them. Fatty fish, including salmon, mackerel, and sardines. These include omega-3 fatty acids, which protect the brain in ways that vitamin E supplements never could. 2 servings each week can cut stroke risk by 30%. That's better than any drug. and there's no risk of bleeding. In fact, omega-3 fatty acids aid in the normal clotting of blood when necessary. Dark leafy greens, such as kale and Swiss chard, beets increase nitric oxide and keep blood vessels flexible. Pomegranates have chemicals that specifically protect against strokes. These are more than just foods. They are pure, safe medicine. Then there's the Mediterranean diet plan. People who follow this eating pattern had 30% fewer strokes than those who eat a standard Western diet. It's not about a single magical food. It's about a lovely symphony of olive oil, vegetables, whole grains, fish, almonds, and, if your doctor allows it, a little red wine. This is how humans are supposed to eat. Exercise is also vital. You do not need to run marathons. A vigorous 30-minute walk every day prevents strokes more effectively than any vitamin pill. It keeps your blood vessels flexible, your blood pressure under control, and your brain properly oxygenated. It even helps your body manufacture its own antioxidants, which are considerably more potent than anything in a bottle. And here's a curious fact that few doctors discuss: social interaction protects against stroke. People with strong social networks much less likely to have a stroke. Loneliness is as harmful as smoking. So join the book club, drink coffee with pals, play cards in the senior center, volunteer in the library. Your brain thrives on human interaction. Quality sleep is extremely important. Poor sleep is more likely to raise the risk of stroke than practically any other factor. The first thing to address is a lack of 7 to 8 hours of decent sleep, not with sleeping drugs, which carry their own risks, but with proper sleep hygiene. Before bed, keep the room dark, the temperature cool, and the screens turned off. 1 cup of chamomile tea. Rather than reading the news, try a nice novel. Stress management is also crucial. Chronic stress destroys blood vessels and raises the risk of stroke. Find what helps you relax, whether it's meditation, deep breathing, mild yoga, or gardening. Your brain will thank you. Now I'd like to reveal something that could save your life or the life of someone you love. Everyone should be aware of the warning indications of stroke. If you have a sudden, severe headache that is unlike anything you've ever felt before, especially if you've been taking high-dose vitamins, seek medical attention immediately. Do not wait. Do not worry about overreacting. Time is brain tissue. Other key warning symptoms include sudden confusion or difficulty speaking, sudden numbness or weakness on one side of the body, sudden visual issues in one or both eyes, and sudden difficulty walking or losing balance. Remember the acronym fast-face drooping, arm weakness, speech difficulties. Time to dial 911. But here's what I want you to understand. It is always better to prevent than to treat. And avoiding stroke does not necessitate hazardous supplements that could backfire. It necessitates simple, time-tested tactics that people have employed for thousands of years. Good nutrition, regular exercise, adequate sleep, meaningful relationships, and stress management. I think about my neighbor frequently, Barbara, whom I mentioned earlier following our talk. She promptly stopped using high-dose vitamin E. She started eating almonds every day, added blueberries to her breakfast, and went on nighttime walks with her husband. 6 months later, her blood testing is excellent, and she says she is feeling better than she has in years. However, not everyone is that lucky. I can still see Richard fumbling with his speech. Patricia is living with the effects of her near-fatal bleeding. My own sister has made great progress but will never be the same. Every time I see them, they say similar things. I wish someone had warned me. Consider yourself forewarned, but more importantly, consider yourself empowered. You now know something that may save your life. You are aware that high-dose vitamin E is not the innocuous helper we once assumed it was. You are aware of the most effective methods for protecting your brain and heart. You have the ability to make alternative choices beginning today. Be warned. Most essential, empower yourself. This information could save your life. High-dose vitamin E is not as innocuous as we once imagined. You understand the most effective brain and heart protective procedures. You can make a different choice today. Please complete this now. Avoid waiting until tomorrow. Access your medical cabinet. Check your vitamin E levels. Check the dose. If it surpasses 400 IUs, consult your doctor immediately. If you're taking it with aspirin or other blood thinners, talk to your doctor about it right away. Do not stop. Include brain-protecting items in your diet immediately. Walk tonight. Call the friend you have been meaning to see. These simple steps are more effective than medicines. They're safer, more pleasurable, and environmentally beneficial. I've discovered that the human body is capable of great strength when given the proper conditions. Consider real food, movement, rest, purpose, and connection over megadoses of synthetic vitamins. The fundamentals that our forefathers instinctively understood but have since been forgotten in this pill-popping culture. I believe there has been a watershed moment in our understanding of health and aging. We are rejecting the more is better mentality that has brought so much grief. We've discovered that the best medication isn't usually medicine. I'd like to know what one adjustment you'll do today to naturally protect your brain. A handful of almonds could replace that harmful supplement. Perhaps you should speak with your doctor about supplements. Perhaps it is strolling with a partner rather than taking medications alone. That one option could save your life. Remember your morning selections. You can continue on a dangerous path or embrace evidence-based wellness, the route to simple, lovely living, not medications. Share this information if it has opened your eyes and you believe it will help someone. Whether you are proud or ashamed, you can save someone's life. Subscribe to discover how to age better, stronger, and sharper, because your best years lie ahead. They are ahead. You only need the correct information to arrive safely. Your brain expects you to make sensible choices. Do not disappoint. Be more than a medical cautionary story. Be an inspiration instead. Someone who heeded the warning, changed, and lived well for decades. This is essentially about that. Not simply avoiding strokes, but living a purposeful, connected, and joyful life that makes each day a gift. Drop the vitamin E bottle and take a handful of almonds. Stay vigilant, safe, and responsible for your health. Check that those hands are holding the correct bottle. Make sure they desire to live, not die. You get to decide. Choose wisely. Your future self will admire you. Subscribe to Bond Senior Health to see more videos. Thanks for watching.